Good morning, students, second year. Today we are going to talk about medical tools, medical medicine, medical supplies, and tools used in medical offices. So today, what we're going to learn today mostly is tools and supplies that doctors, nurses can use in a hospital. The first one we are going to start with is syringes. Syringes. Everybody know what a syringes is. That's the tool that you have to put in the patient's skin, either to retrieve some blood or whenever you give a vaccine or whatever, you use a syringes. So there's no need for us to see what a syringe is. Everybody know what a syringe is. The next one is vaccines. Vaccines. Everybody has to be vaccinated. Everybody has to be vaccinated, and you know that vaccines. The next one is exam gowns. Exam gowns. That's what you call the robe d'examen. Exam gowns. The blues d'examen. I'm sorry. Blues. Blues d'examen. That's what the doctor sometimes they wear when they are going to have a surgery. They put a gown. Sometimes also some patients can use a gown when they are going to the surgery room. They put a gown, so that's what you call the blues d'examen. Gown. The next word we're gonna talk about is cotton balls, and swabs. Cotton balls. Cotton balls, ce sont les petites boules de coton, cotton balls. And the next one we're gonna talk about is swabs. Swabs. What is swabs? The medical term for that is les écouvillons. Swabs. Cotton balls and swabs, ce sont les boules de coton, les écouvillons. Boules de coton, that's, you already know. There's no need to say much about it. Suturing materials. Suturing materials. Ce sont les matériels de suture. Matériel de suture. As you can see, I'm gonna try to put the French words next to it because I'm sure many of you have not done the necessary to learn or even to look for those words in the dictionary or even in Google. But that's fine. I'm gonna do it for you, so at least you know the words in French and then their meaning in English. Suturing materials, so some material de suture, after like a cut. If the doctor need to sue you, okay, sue, SEW, could, and they use the material de suture, to make sure they put the coudre, la blessure, or whatever. As you already know, I am not a doctor. I am an English teacher. So what I'm doing, I'm just trying to explain the words to you. So as far as definition, the medical procedures, I don't know, and everybody already knows that. That's fine. Mask and glove. Mask, put over your face like mask. Gloves, ce sont les gants. Gloves, gants. You have to use glove whenever you are touching a patient. You need to put gloves because not only you have to protect yourself, but also you need to protect the patient. For instance, someone who's bleeding, quelqu'un qui est en sang, qui a du sang sur sa peau, whatever. You cannot just go and touch the person like that. Of course, you need to put gloves, some gloves, in order to protect yourself as well as for the patient. The next word we are going to talk about is the sterilizing solution. Sterilize. Pour stériliser des trucs you can use to sterilize someone. So there's not much we can say about sterilizing, to make sure to stériliser la blessure ou quoi que ce soit. Cyclometers. Cyclometers, cyclometer, thermometer, stethoscope, otoscope. Everybody knows that. We are not going to spend much time about that. The next word we are going to talk about is tongue. Tongue depressors. Tongue depressor. What is a tongue depressor? The tongue depressor, that's what you call it. Des abaisse langue. Abaisse langue. It's a tool that you put in the patient's mouth under the tongue. Okay, I don't know, maybe to check the temperature, or I don't know, but you know what I'm talking about. Okay, the tongue depressor is something you put under the patient's tongue, hein, sur la langue du patient. Ok, il y a cet instrument que l'on utilise des fois pour vérifier. I don't know, je ne sais pas ce qu'on vérifie. Je ne suis pas médecin. Everybody knows that. I'm not a doctor, so please don't ask me. But at least I want you to know what I'm talking about. Okay, the tongue depressor. What is a tongue depressor? It's a tool that you use. You can put under the patient's tongue, right here, and sometimes, I guess for children, to check the fever, the temperature. That's what you call a tongue depressor. Very good. The next word we are going to talk about is the pen light. A pen light. A pen light is some kind of, I can say, the type of light lunette that you can use either to look in the patient's ears, or maybe the nose, or maybe in the mouth. Okay, so some of the lunette. Okay, a pen light. So the plume, lumière, whatever they call them, so it's to check, to look deeper in the patient's throat, maybe. They put the pen light, or maybe in the ears, to look at the ears, or maybe the eyes, to make sure that's light. The ear scope. Ear scope also, it's an instrument they can use for, as you can see, the ear. Sometimes. I mean, it's a tool that you put inside your ear to check, if you have an ear infection or anything like that, So they put it inside your ears to check if you have any problem with your ears. Good. The next words we are going to talk about is the surgical instruments. Surgical instruments. Surgical instruments, ce sont les instruments que l'on utilise dans les salles d'opération, ou quand on va avoir une intervention chirurgicale. The instrument surgical. A scalpel. Scalpel is the same thing in French. Scalpel. Forceps. Forceps. Forceps, ce sont des pinces. Pinces. Forceps. Ce sont pinces that the doctor uses, to hold some body parts, whatever, during the surgery. Hémostat. Hémostat, ce sont hémostatiques. Hémostatique. Hémostat. The needle holder. Needle holder. Ce sont des portes aiguilles. The porte aiguille. The porte aiguille, something you can to put les aiguilles, the porte aiguille, the needle holder. We already spoke about syringes. You know what syringes are. And the next one is scissors. Scissors. Ce sont les ciseaux. So as you can see, all those words are the words you are going to use for whenever you are going to perform a surgery. That's most likely the tools, the instruments that a doctor is going to need to perform a surgery on a patient. We have the scalpel, the forceps, hemostats, needle holder, syringes, scissors. That does not mean this is it. I am just giving you some words. I am sure there are more than that that you can use. You can use as to. There are more than that you can use in a surgery, um, in an operating room. Operating room. We already see this word last week. The operating theater, c'est la salle d'opération. Good. We have three new words. We have pills. Excuse me, just 1 second. Feel like my throat. Thank you. Sorry. We have two new words. We have pill, tablet, and capsules. Pill, tablet, and capsules. Pill, of course, ce sont les pilules. Tablet, ce sont les comprimés. Pilule, comprimé, and of course a capsule. Okay, comprimé, pill, tablet, and capsule. Capsule, capsules. Good. We are going to continue with our word, a syrup. Everybody know what a syrup is. Ointment. Ointment. Ointment says ointment here. That's what you call pomade. Ointments. Ointments after a patient has. We spoke about a wound last time. Remember wound. Wound. C'est une blessure. Blessure ou plaie. Okay. If the patient is wounded or has a wound, remember to do the dressing. And dressing, we already saw this word also last week. Dressing, dressing, c'est ce qu'on appelle les pansements. Pansement, okay? Or dressing. When you do dressing, of course, you need to sterilize. Sterilize. We just learned that word earlier today. Sterilize the wound. Steriliser with alcohol or whatever you use. And of course, you need to put some ointment. Ointment. The pommade que l'on applique des fois sur les blessures, sur les plaies. Ointment. And of course, after you use a bandage or whatever, or a band-aid, whichever, it's necessary. I don't know. This is for the nurses. That's the nurse's job to know how to do a dressing. Il y a les corsets. Also, that is a word we are going to learn earlier. We are going to learn today. Corset. Good. So ointment. Here, ointment. Ce sont les pommades. Ointment. It's the you use for the dressing for the wound pomade. Cream, of course. You already know what the cream is. Of course. And the eye drops. Eye drops. What is the eye drop? It is little good that you drop in the patient's eye. If they have eye problems, you drop. It's a good, right? And I believe sometimes the medical for this word is collier. Collier. I'm not sure, something like that. That's why collier. That's what's called for eye drop. Okay, eye drops. The next one we are going to talk about is tranquilizer. Tranquilizer. Ce sont bien entendu des tranquillisants. Tranquilizer. All these words are almost the same thing. We are going to learn here. Tranquillisant. Okay. Tranquilizer. And of course we have the painkiller. Painkiller, we have two words. Pain, douleur. Killer, assassin. Donc les assassins de douleur. Non, ça c'est pas le mot. The word in English is analgesic. There's an analgesic, a painkiller. So it's a two word. But if we are trying to define each word by itself, pain is douleur, killer c'est un assassin est douleur. Donc, the medical term is the analgesic. A painkiller, analgesic. Analgesic. Very good. Painkiller. Good. Painkiller is analgesic. And of course, antiseptic is antiseptic, the same thing. And antifebrile, c'est ce qu'on appelle les antifébriles. It's the same thing, antifebrile. If you don't know what that is, please go look on the go on Google to see what an antifebrile is. It's a kind of machine they put on the patients. I believe when they have heart problems, to reanimate, if the patient is doing consciousness, the antifebrile, les antifébriles. Okay, so c'est une sorte de machine que je pense que l'on met près du cœur. I'm not sure, okay, but you can do some research about it to know what the antifebrile is. Antifebrile. Good. Dressing. We just saw that word earlier. Or dressing, c'est ce qu'on appelle les pansements. A dressing. Okay, for the nurses, les infirmiers, les infirmières, comment faire un pansement. Okay, a dressing. There are many steps. On a déjà expliqué ça. We already spoke about it here. First, you need to clean the wound. Nettoyer la blessure. Clean it. Sterilize. Okay, clean the wound. And of course, you need to put some ointment, the pomade. Apply some ointment. Okay, and if possible, next time you can use a gauze, gauze that we are going to cover tout à l'heure. Okay, so for the dressing first, pansement, dressing, bandage, bandage, pansement, a cast. A cast, that's what you call a plâtre. It's the same thing as plaster. Plaster and cast, they are the same words. That's what you call plâtre. Avec accent circonflexe, bien entendu. Plâtre. PL accent circonflexe, TRE. Plâtre is the same thing as plaster. The same thing, plâtre. A gauze. C'est ce qu'on appelle toile gauze. Okay, toile de gaz, the gauze. So as you can see, all those things are necessary for the dressing. First, you need to clean the wound. Then apply some ointment. Then use a bandage, brace, a plaster. Good. Okay. So the next word we are going to talk about is the elastic tape. Well, everybody know what the elastic tape is, so we are not going to talk about it. Brace. A brace. Oh, I forgot brace. What is brace? Brace, that's what you call a corset. Les infirmières. Corset. A brace. Okay. A brace, a corset. Plaster, of course, plâtre, elastic tape, Oxygen mask, les masques d'oxygène. Oxygen mask. A test tube. A test tube is a tube essai. The test tube. Test tube. Should be said. Okay. For instance, if you go to the doctor and they need to check your check something, and they take your blood, they're gonna put it in a vial. A vial. What is a vial? Vial, c'est ce qu'on appelle un flacon. Flacon. A vial. Vial. A flacon. Vial. A flacon. IV bag. What is an IV bag? IV, c'est ce qu'on appelle les sacs intraveineux. IV bag. Sac intraveineux. So maybe I am sure most of you know what is a IV bag. Un sac intraveineux, c'est le truc, un petit sac qui contient qui contient le liquide là, ok, qui descend dans les tubes pour aller sur le patient, ok, c'est ce qu'on appelle le sac intraveineux, le IV bag. IV bag, hein? Quand vous allez à l'hôpital, quand le patient est sur le lit, il a besoin qu'il y a un sac là, le sac qui est accroché, et puis il y a le qui descend, ok, that's what you call the IV bag, sac intraveineux. The next one is the blood pressure monitor. Blood pressure monitor. C'est ce qu'on appelle le tensiomètre. Tensiomètre. Blood pressure monitor. Tensiomètre. Blood pressure monitor. And we have the crutches. Béquille. Béquille. Crutches. And of course we have wheelchair. Béquille. Et wheelchair, c'est la chaise roulante. Wheelchair. Wheel. Chair. Chaise. Sa chaise roulante. So basically, those are the words we had to study today. As you can see, those are words that use some medical supplies and tools que l'on utilise dans les bureaux d'office, dans les hôpitaux, dans les salles d'opération, So, what I want you to do for me as an exercise, you can send it to me on the group, on the platform, if you want. Send it to me on the platform, or you can send me on WhatsApp if you want to. I want you to a little exercise. You are going to write a paragraph about 5 lines using some of these expressions some of the expression that we have learned using some of the expression we've learned today. Okay, so you are going to write a paragraph about 5 lines simply use all the expression. For instance, you can say as a doctor I used forceps when I perform a surgery. My patient needs a wheelchair because he can't walk, and so on and so on and so on. Okay, so I want you to try to use at least 10 words. Okay, so by expression, at least 10 words. Je veux que vous utilisez au moins 10 de ces mots dans votre petit paragraphe de 5 lignes. Okay, So make some nice, good sentences. This is a little exercise I want you to do so you can practice those words. Please do not use the easy words, like um, 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 easy words like wow. Any of those words are easy anyway. There are some very difficult words, but I want you to remember them. Okay, what is an eye drops? What is the difference between eye drop and eardrops? Okay, the difference between eye drop and eardrops. The tranquilizer, painkiller, antiseptic. Okay, gauze, gauze, a vial. Okay, um, um, a needle holder. Ce sont les portes aiguilles here. Uh, Needle holder. Okay. So basically, this is it for today. I hope you had a chance to learn a lot of those words we've seen today, we've studied. And then again, if you have any questions, I'm available. You can send me a WhatsApp, or even you can send me a message on the platform, and I will be more than happy to answer you. Having said that, I hope everybody has a blessed and safe day. Please stay safe. Stay safe. Wash your hands. Stay home. Okay? Unless it is an emergency, you have to be out. But please stay home. Because we definitely need to stop to fight this pandemic. And you already know, as medical student, nursing student, what a pandemic is. And if this thing really starts to be starts to spread here in this country, we don't have the medical stuff, we don't have the medical equipment to take care of all those people. So it's going to be a disaster. So let's pray and let's hope that they get a cure for this virus before it gets worse. In the meantime, have a blessed, safe, and wonderful day, and I will see you soon.